Hello, it's Dr. Brian Petrie from Regenerative Medicine and Regenerative, and today I would just like to briefly talk about a question that I get often from patients that have come in and they've been suffering from some type of joint-related degeneration, and they've been to a doctor and the doctor has suggested that they undergo a PRP procedure, which stands for platelet-rich plasma. And the question they have to me is like, is this really the best option for them? And I'd like to be able to explain this in a way that hopefully would give you enough information, if I explain it correctly, that you would be able to answer this question yourself. So most of us by now have already heard about stem cell or exosome type therapy. And the power of these is not so much the stem cells themselves, but it's the byproduct or what they give off or they secrete once they've been put into the body. And it does come from several sources, and it really depends on what you are trying to achieve to determine what's going to give you the best outcome for your knee. So some of the areas that we can get these that they're derived from is from bone marrow, which basically it's a injection or an extraction of bone marrow that usually is from the hip or the pelvic area, and they take those stem cells out and they're injected into the joint. The other is PRP, which stands again for platelet-rich plasma. There's also can come from fat and again umbilical cord tissue, which is known as Wharton's jelly. Now, when you take the growth factors from bone marrow and you put them into a joint, 100% of the time those growth factors are going to want to turn into bone. When we take them from PRP or platelet-rich plasma, they want to create or they want to turn into fibrin, and fibrin is a type of scar tissue. If we take it from fat, 100% of the time those growth factors are going to want to turn into fat. Wharton's jelly, again, comes from umbilical cord tissue, and the growth factors that are released from that will differentiate or turn into type 1, type 2, and type 3 collagen. Now, if you're looking at a joint, what is the joint made of? So this is the articular cartilage at the end of the joint, also known as hyaline cartilage, which is made from type 2 collagen. The meniscus, the ligaments are made from type 1 and type 3 primarily. So the growth factors that come from umbilical cord tissue are exactly what is needed to actually get the best outcome for repair of that joint. So the question is, do you want bone marrow? You want something that's going to turn into bone? Do you want something that will turn into scar tissue, fat, or do you want the actual upregulation or repair of the tissue that's been damaged from degeneration? So I hope that helps you answer the question if a doctor has ever told you that you need to get PRP into the joint, because it may not be your best option.